Well, hello once again, and welcome to 5 Questions with an ISHLT member. I am Jess Burke, Director of Marketing and Communications with the International Society for Heart and Lung Transplantation, and I am here today with Dr. Joseph Spinner. Good morning, Joey.
Good morning, Jess. Thanks so much for having me.
Well, thanks for taking some time to chat. Before we dive into our 5 questions, do you mind sharing who you are, where you work, and what your role is in ISHLT?
Sure. My name is Joey Spinner. I'm an assistant professor of pediatrics at Texas Children's Hospital and part of the heart failure and transplant team here. I completed all my training, my residency and fellowship and heart failure transplant fellowship all at Texas Children's. In terms of my relationship with ISHLT and my role, I'm an early career and a pediatrics professional community member of the ISHLT.
Well, that's great. And so can you tell us a little bit about why you got involved in ISHLT in the first place and what keeps you connected with the society?
Sure. So I knew as a cardiology fellow, I was interested in heart transplantation. And so I attended the ISHLT meetings in Washington, D.C. and San Diego, and then in Nice as a fellow, and obviously had a great time. And what stood out to me at the ISHLT, as opposed to some of the other meetings that we go to as trainees, was beyond all the incredible science that was obviously presented there, was just how amazing the pediatric heart transplant community, the ISHLT is. They've been so welcoming and create so many opportunities for fellows and the junior faculty, such as myself. And there's really not an organization that does that like the ISHLT does.
Absolutely. Well, I'm glad it was such a positive experience for you while you were coming up. What inspired your career path? You talked about being interested in pediatric cardiology and transplant. How did you get there?
So as a medical student, I rotated on a congenital heart surgery service, which mostly meant standing in the corner or scrubbing in occasionally and observing cases in the operating room, but also rounding on patients in the ICU as part of the surgical team. And during the rotation, I got to become very close with a number of the families, particularly a family of a small child in the ICU on a VAD waiting for a heart transplant. And one afternoon, our head surgeon, Dr. Frazier, asked if I wanted to join him to go on a plane and go for an organ procurement. And lo and behold, it was actually for a heart for this one child, this one family that I had become very close with. And I remember staying there all night in the operating room after we had flown back to Houston, and staying there in the ICU and taking care of him and rounding on him all week in the ICU. And now it's been 10 years later. I'm now one of his pediatric heart transplant doctors on the team, and I've been following him and stay close to the family for all these years. And only something like pediatric heart transplantation allows you the opportunity to get to do something like that.
Yeah, and it's a field where every birthday is very meaningful, right?
That's right. And actually he got his heart on my actual birthday. So his heart birthday and my birthday are the same. So I was
Your first patient. What a special connection.
Yeah. Yeah. I wasn't intending to stay all night at the hospital that night, but it certainly changed my career path, definitely after that.
Yeah, a birthday for both of you. So what's a meaningful milestone? I mean, that sounds like one, but what's a meaningful milestone in your career or in the field of pediatric transplant that you'd like to share?
Sure. So I've been interested in a long time in the role of the intestinal microbiome and its possible interaction with the immune system. And so in particular, in pediatric cardiology, how this may affect pediatric heart failure and heart transplant outcomes. And I was very excited to recently receive a grant from actually the Department of the Defense, of all places, to study the role of the intestinal microbiome and metabolome and its impact on pediatric VAD and heart transplant outcomes. And so I'm extremely excited about that, and look forward to learning a lot of information and then sharing it hopefully one day soon at the ISHLT.
Well, congratulations on that. And you read my mind. I was going to say, I hope that we'll see that at ISHLT 22 or 23 sometime soon.
I hope so. Certainly hope so.
Yeah, well, I know you kind of already answered this maybe a little bit, but when you think about your specialty's future, what do you see on the horizon for pediatric transplant?
Well, what I hope to see and what I believe in is really the personalization of care. Um, and as our technology improves, as our understanding of the immune system improves, and as we are better able to collaborate and learn from each other through the ISHLT, I'm really hopeful and excited about a future of personalized immunosuppression, as well as non-invasive detection of rejection in pediatric heart transplantation. And so hopefully at the same time, while we're learning about these things, there's some incredible people who are making advances in donor organ protection and preservation. Many of these people presented their work this past year at this last virtual conference. And so hopefully while that's happening simultaneously, we can hopefully someday allow us to find the perfect organ for the right patient, something that hasn't been possible in pediatric heart transplantation. And my hope is that these patients can receive a personalized immunosuppression based on what we know about the donor and what we know about the recipient in terms of their HLA and profile. And hopefully we can also someday be able to follow these patients and surveil them without having to do so many cardiac catheterizations and biopsies. So that's my hope, but I know there's a lot of really good and smart people at the ISHLT who work on these things, and I'm excited about the future of these endeavors.
Absolutely. When you're not doing pediatric care and transplantation, what are you up to? What's your idea of a perfect weekend?
So I have a 4-year-old and an 18-month-old, so sleeping in is no longer part of the weekend plans, but I try to spend as much time with my daughters as I can. If they're taking a nap or have a few moments away, I like to watch baseball. So that would be my perfect weekend.
Well, I'm a rabid White Sox fan, so hopefully we're not too much of enemies. So
I haven't forgiven you guys for sweeping the Astros, but that's okay.
Well, we'd earned one, I think. Well, it's been so nice talking to you, Joey, even though now I know we're bitter rivals. And thank you so much for taking the time to chat with me today. Is there anything else you want to share with the ISHLT community that we haven't already covered today?
No, I just want to thank you for this opportunity to do this with you. I know you guys are highlighting junior faculty, and I think that that's one of the many things that makes being a part of this organization really so incredible, and the opportunities that you guys provide for fellows and then for junior faculty such as myself. So thank you very much, and hopefully at a someday soon, all this will get to be in person, but I guess we'll wait for that to happen.
Yeah, hopefully it's this April in Boston. Great to meet you, Joey.
Likewise, take care. Thank you so much.
Thank you.